For a normal labour to occur, a baby generally needs to be in a longitudinal line with a cephalic, meaning head-first presentation, in either the left or right occipito-anterior position with a well-flexed chin. Towards the end of pregnancy or during early labour, the baby should start to descend into the maternal pelvis. As the labour progresses, especially during the second stage with increased uterine contractions, the baby's head should start to become engaged with the pelvic brim. This is where the sagittal suture line should be lying within the transverse diameter of the maternal pelvis. As contractions strengthen, flexion should occur, which is where the sinciput, the baby's face, and the mentum, the baby's chin, is flexed towards its chest, which reveals the suboccipital brachmatic diameter of the baby's head, which is the smallest diameter to pass through the inlet. As this passes through with each contraction, the next diameter to pass is the biparietal diameter, which is the widest diameter to pass through of the fetal head. As the occiput presses against the pelvic floor, an internal rotation occurs due to the anatomy of the maternal pelvis. The baby's head begins to turn, and a misalignment occurs between its head and the rest of the baby's spine and shoulders. Crowning occurs once the occiput sweeps past the pubic symphysis and remains visible during the time between each contraction. The head is then birthed by extension. Once the largest diameter, the suboccipital frontal diameter, is passed through the vaginal canal and sweeps past the perineum. From here, restitution occurs, which is where an external rotation happens so that the baby's head realigns with its spine and its shoulders. After this occurs, the shoulders begin to press against the pelvic floor and are encouraged then to also twist internally so that they can match the anatomy of the maternal pelvis, resulting in another misalignment. As the contractions continue, the anterior shoulder sweeps past the pubic arch, and is birthed first, with the posterior shoulder sweeping against the perineum and coming through. With each contraction, the mum should be pushing. The baby should then be born healthy and happy.